He's gonna make it clear. Did you know? Come on, listen here. Did you know?
Hello and welcome to the Did You Know Show. My name is Bryant Green and today's show is brought to you by Always Best Care. Today we have the pleasure to sit with the CEO of the Henry J. Austin Center, Dr. Kimmy Ali. And we're going to talk a lot about the centers and their services and their outreach. And without further ado, I have with me Dr. Kimmy Ali. How you doing?
I'm very good. Thank you for having me. I'm
so
excited
glad,
to be here.
I'm so glad to have you here. My good friend Alona Duprez connected us.
Yes, that's right.
She's the Chief Development Officer. And anyhow, she connected us, and I just thought it was just phenomenal. The Did You Know show is centered around connecting people to home, community, and business resources that they ordinarily wouldn't know about, and how accurate for us to be here. So tell us, for you, why here?
So I grew up in central New Jersey, so I'm from Somerville, which is a stone's throw away, down 202, 206.
Okay.
And when I grew up, I had a big family, lots of individuals. My mother was the first individual to go to college.
Okay.
I'm the first among my cousins to go to college. And when I decided to go into medical school, I just always knew I wanted to work with people like my friends, my family, and my loved ones. Mm-hmm. Growing up in Somerville, it's a small community, but it's very close-knit and tight. And I could see the need. I have in my family, my grandfather died of lung cancer, my grandmother died of colon cancer, I have an aunt that had breast cancer, I have individuals that succumb to alcoholism and cirrhotic, problems with their liver. I have people that are homosexuals in my family and they died of AIDS. I have people that have been incarcerated, so a little bit of everything.
Right.
And I always knew they were still individuals that loved, wanted to be loved, they cared about their family and their friends, and they were trying to do the best they possibly could. When I got into medical school and residency, it was there I learned for the first time that people are actually treated differently based on the color of their skin, or also based on how much they have in their bank account, or don't have in their bank account.
Talk about it.
And I was always shocked by it. It took me by surprise, because growing up in Somerville, again, very close-knit family, I just always felt the love, the caring, the warmth. And that's not to say there weren't struggles.
Right.
I always joke that I was extremely poor and had no idea. Had no idea.
I don't know what you mean.
Had no idea I was poor, because everybody always told me I could reach for the stars. I could, as long as I had a dream, that I could go for it. And again, so when I was in medical schools, when I realized that, people are treated differently because of what they have or don't have. People are treated differently because of the status they have or don't have, or because of the color of their skin, or because of where they're from, because they've immigrated for somewhere else. And again, that just never sat well with me. So when I graduated, I knew I wanted to work with people that look like my grandmother and my uncle and my nephew and my son.
Okay.
Yeah.
It's interesting you say that. As you're talking, and when you talked about your family background and you very transparent, I always find myself telling people that I have a couple of degrees also, but my modest foundation of what some would call dysfunction has equipped me to really, really be able to interact in the community.
That's right.
And I'm very proud of the multicultural staff that I have put together. And so, the intergenerational staff and the multicultural staff, it's important, especially when you're serving the community. And, these days and times when we're dealing with a pandemic, you really are tested in so many different ways. So kudos to you, because I know I've had some friends that have gone through medical school. And, it's funny when you talk to people, I used to talk to people in medical school, I always ask them not to become cold and hardened. Because a lot of times when you're in in the medical field, you're forced to manage the people according to their means.
That's right.
And even though you might have a whole list of maybe medicines and prescriptions that people could benefit from, it doesn't necessarily mean that they can afford them or have the means to get them. So here we are at Henry J. Austin. How long have you been here?
I have been at Henry J. Austin Health Center for 24, almost 25 years.
Wow! Wow! So you sat through some chairs. Now when you start, okay, now you just can't say that and walk away. Where did you start at?
So I'm a pediatrician by training. So
Okay.
I graduated from Robert Wood Johnson in New Brunswick.
Hey.
Hey. Then previously before that I was at Rutgers. I went to Rutgers, then to Robert Wood Johnson. So all in the New Brunswick sort of Piscataway area.
Okay.
And then as I said, when I graduated, I knew I wanted to work in a community that reminded me of my childhood, reflected on my family, my friends, and the people that I loved most.
Okay.
And so I applied to community health centers in sort of a 20 or 30 mile radius. And Henry J. Austin was the one that said, yes, come down and have an interview. So I started out as a part-time pediatrician, then became a full-time pediatrician. So I worked on the front lines for about 10 years at Henry J. Austin. And then I became the chief medical officer and now the CEO for the last 6-7 years or so.
So have some of your early patients ever come back to visit you? Tell me
All
about
the
that.
time.
Yeah.
It's
Do they bring their kids back?
They do. So I've seen whole families grown up. I mean, literally, it's like a family. You know, I've seen babies being born that are now, 18, 19 years old. I've seen, individuals that were in their 30s and now are grandparents, and they bring their own grandchildren. I mean, I've seen everything, so it's very rewarding.
Wow. If you just tuned in, I'm sitting here talking to Dr. Kimmy Ali. She's the CEO of the Henry J. Austin Center. So let's talk about Henry J. Austin. Let's talk about the centers. My understanding, first of all, you guys have multiple locations.
Yes. We have 8 locations around the city. Yes. Okay. 4 of them, actually it's 9. 9 locations around the city. We have 4 of our sort of flagship, larger locations, like this is one, Ewing. We have Warren, we have Chambers, and Bellevue. We have an administrative office in Nottingham, so technically that's Hamilton. It's on the border of Hamilton and Trenton. And then we have, which we're also very proud of, we have 4 sort of primary care offices that are embedded in other institutions. So we have them in the mental health institutions in and around the city. So one at Catholic Charities, one at Oaks Integrated, and one right across the street at the Rescue Mission.
Wow.
And we provide primary care services to those individuals.
So you're pretty much dealing with folks that have really modest means.
Exactly.
Okay, and they have a community, the community hospitals are so important.
Yes.
We hear people talk about food deserts and clothes deserts, and really nowadays just, lack of resources in our community. It's great to be able to come to a community hospital. So why is this important from a physician's perspective?
Yeah, so one of the things, you hear a lot of talk about social determinants of health. And that's just what you described. So food insecurity, housing insecurity, transportation problems, all of those things that surround someone getting healthy or not. And health centers, we've been doing this work literally for decades. We are founded on this work of treating not just the healthcare needs of an individual, but really the whole person. You're treating the whole person and everything that they need. When you look at the history of health centers, I'm always so amazed by that. Many health centers were founded in helping people establish gardens and farms and digging wells in their local community and helping them get electricity. That was some of the sort of heartland work of health centers back in the 1960s when they were first implemented. And so again, health centers have this long history of looking just not at the health needs. It's just one part of what a person needs to be whole, happy, and healthy, but really surrounding that person with everything they need. And that's the work that we do every single day. So when you come to someplace like Henry J. Austin Health Center, we will help you get a ride if you don't have transportation. We will literally make sure you get here and back. Or if you need a ride to your specialty care appointment, we'll help you with that too. As you mentioned, we help individuals with their medications. We ensure that every patient leaves with their medications, whether they can afford to pay for it or not. We have translation and interpretation services, so you don't have to come with someone who speaks a certain language. No, we understand that's a need, and so we provide for that. And we have social workers and pharmacists and behavioral health counselors and all other kinds of individuals, again, really wrapping them around with all the services that they need to be whole and healthy.
What is the staff culture here? What is the culture here, if I'm asking?
So a lot of people will talk about it like a family, that it's really a feeling of a family. Right before you came in and your team was setting up, I saw one of the medical assistants that I haven't seen for a while, and she gave me a big hug, and she was like, "Oh my gosh, it's so good to see you." And I was like, the same thing. It's COVID has really shown how important family is, and Henry J. Austin Health Center has been no different in terms of really how we think about our employees, how we treat them. That idea of a family is important to us.
Wow. Well, we're going to take a quick break. On the other side, we're going to come back and we're going to talk about the services that Henry J. Austin offers. I want to get into, can people get the services a la carte and that kind of thing. So don't go away. We'll be right back.
Did you know?
Let me help you with that, Mrs. Jackson.
Oh, thank you, dear.
How'd this get here? You got one too?
Yeah.
Ah, new recruits? I'm sure you're wondering why you're here. This is our Elite Caregiver Super Training Center, and you two are the perfect candidates.
This is incredible.
I know, right? Ready to become an Always Best Care caregiver? Working for the best team with competitive pay? Join Team Green.
Always Best Care supports diversity. There's a hero in all of us.
Dad, you can't do this anymore. I think it's time to consider a nursing home.
But I don't want to leave my home. All my stuff.
But Dad.
Alva.
Always Best Care is here to help.
With Always Best Care, we come to you and do anything you need to continue living at home with our care.
You really are a hero.
Let Always Best Care take care of your loved one. Everyone deserves the best care, always.
Did you know?
Welcome back to the Did You Know Show. I am here at the Henry J. Austin Center, and I'm sitting here with the lovely Dr. Kimmy Ali, and we're having this great conversation. And I wish sometimes that we could do the outtakes of what we talk about when we go off. But I want to come back to the services that Henry J. Austin offers. Can you talk about that?
Yeah, so we have comprehensive list of services. So we provide the basics.
Okay.
We have pediatrics, we have adult medicine, we have women's health care, we also have dental care, we have behavioral health care, and then as you mentioned, we have all those other services that surround the patient. So we have a pharmacy and pharmacy services.
Okay.
We have services for if you have asthma or if you have lung disease. We have a nutritionist. We have services for interpretation and translation. We do blood draws and blood work. We have podiatry. So a full list of services that you can see on our website, www.henryjaustin.org. Comprehensive list of services. So everything that you really need. The only service that we don't provide is OB, but we provide everything else.
And so, if you're looking at the bottom of the screen, you will see that website and you will see the phone number. What are your hours of operation at your centers?
So 8 to 5, Monday through Friday, and then 9 to 1 on Saturday. But we do have, because of telemedicine now, so we have an on-call service, and if you need to see a provider after hours or on the weekends, you can also call and get to see your doctor as well.
And so let's explain, because I'm in healthcare. And we often think that people, sometimes we say words or phrases out there that we think that people understand. Can you explain telehealth? What is that all about?
Oh, yes. So telehealth is where you get to see your doctor or talk to your doctor using video technology or sometimes just a phone. So telehealth includes both of those. So sometimes it could just be a phone call that you get to speak with your doctor or your provider, or sometimes it could be, again, through video technology where you're actually seeing your doctor through your laptop or through your phone if you have a smartphone, and speaking with your doctor that way.
So hear that, Chubby? That's my grandmother. You don't always have to get dressed to go to your doctor's appointments. You can take your doctor's appointments there.
Yes.
Are you allowing your certified nurse practitioners or your physician assistants to write orders at this point because of COVID?
Yes, we do. So our nurse practitioners really are key providers within our organization. They do phenomenal and amazing work, and we probably could not function without them. And so our advanced nurse practitioners really function independently.
Now, is this a teaching facility? Do you have people that come here and do rounds?
Yes, we are. How did you know that? Yes, we are.
I just
So we are a teaching facility for nurse practitioners. So we have an advanced nurse practitioner residency. So for individuals that go to one of the local nurse practitioner schools, like the College of New Jersey, which is right down the road, they can come to our residency program. And then we also have a lot of students. So we work with the Rutgers Pharmacy School.
Oh, wow.
Yeah, we work with the Rutgers Social Work School that rotate through us as well.
You know, when you think about a community health situation, are you guys, I mean, what's your spin? I hate to call the word spin kind of sometimes as a bad way, but population health.
Yes.
Is your facility dealing with population health? What are your challenges?
Yes, population health, right. So we are definitely involved with that. It's part of one of our strategic initiatives. How do we improve the health of the population that we serve? So that means not just the people that walk through our doors, but how are we interacting with the community as a whole? And we do a lot of population health work through our mobile health unit. And so in particular during COVID, our mobile health unit was key in Trenton and Mercer County, doing testing and vaccination and treatment. We do a lot of work with our mobile health unit in immunizing children throughout the city. So a lot of our population health work is done through our mobile health unit, yes.
So when we talk about the community, obviously you're dealing with probably a significant part of the population that is uninsured.
That's
But for those folks that are insured, do you take most insurances?
Yes, we take just about everything.
Okay.
So we take traditional Medicaid and Medicare.
Okay.
We take Horizon, which is one of the biggest insurers in our area, but Aetna and Amerigroup. And then we take commercial insurances as well as seeing those individuals that are uninsured.
Do you offer therapy services here?
We do. So we have a big integrated behavioral health program where we offer traditional cognitive behavioral therapy as well as integrated behavioral health therapy that works with our primary care providers. And so we have licensed clinical social workers as well as psychiatric advanced nurse practitioners that do that work.
Do you go out into the field? Do you does any of your clinical staff go out into the field?
The field work we do right now is primarily through the mobile health unit.
Okay.
That's the one that goes out. Mm-hmm.
Mobile health. Don't just say that and let's think that we know what that means. Again, we talk about telehealth, we talk about mobile health.
Yes.
That's so Y2K. I hear the term a lot, but what does it mean to Henry J. Austin?
So that's really where you take the services to the patient. And we have a mobile unit, or some people might say it's a van, but I say it's much larger than a van, that actually takes the services right to the individuals and community that needs them. So if you have a school, for example, that has a high % of children that are unvaccinated, we'll take our mobile unit on wheels, we'll actually take it to the school and provide immunizations to those children. Or sometimes we might have a particular community that wasn't vaccinated. This was really important back in last year, 2020 and 2021. Where we identified perhaps there was a community that wasn't coming out to get the COVID vaccine, and we would take our mobile unit to that community to help them get vaccinated.
What about the prevention of STIs? You know, back in my day, we called it venereal disease, or VD, and then also the opioid addiction. Are you guys doing anything about sexual health or drug addiction?
Both are really important to the work that we do at Henry J. Austin. So in terms of STIs, we have a full program.
What does STI
Sexually transmitted infections.
Okay.
Sexually transmitted infections. And so we do that work at our health center. We have a grant that supports that work as well. And so, again, you can come to any of our centers and we'll be able to guide you through if you need assistance with that. And then in terms of the opioid epidemic, it's really interesting with COVID. It's almost like we can't, as an industry, we can't focus on two things at the same time. So when COVID hit, nobody talked about the opioid epidemic anymore.
It was still going on.
And it was still going on. In fact, rates are higher now than they've ever been. The amount of opioid deaths have risen dramatically over the last year. And nobody's talking about that anymore. But we are within our institution because we see those individuals, we see those patients. And so we actually have a program for those that have opioid addiction. It's called Medication Assistant Treatment Program, MAT, M-A-T, Medication Assisted Treatment Program. And we provide services for those individuals that have opioid addiction specifically.
Are you doing any type of needle exchange or Narcan? Is that going on?
Yes, we do a lot of Narcan, definitely. Needle exchange is a little tricky because there are constraints we have because we are a federally funded health center. So sometimes there are certain constraints placed on us, and that's one of them.
Wow, wow. So we're here in downtown Trenton. Trenton. For those folks that don't know, and you said you have 9 locations, and we're right now on the 112 Ewing Street location. Yes. Busy as a beaver. I came in here, when you walk into facilities sometimes, it's really reassuring when you walk in and the staff is just so friendly. And just warm. I mean, and it's all kinds of folk here. What do I mean by that? It's young folk, it's senior folk, it's multicultural, it's an intergenerational vibe, and I gotta say, I gotta give it to you, that speaks volumes of what's going on. From a hiring perspective, what are you looking for? Are you, obviously you have the schools and the rotations, but what do you, if you had your wish list in terms of hiring, who would you be going after? The nurses, the docs?
Yes.
I mean,
yes. All of the above. So Henry J. Austin is, unfortunately not untouched by the Great Resignation like everywhere else. People reconsidering what they want to do with their lives. But in particular, nurses. We've had a real shortage of nurses, and that's across the country, right? So again, Henry J. Austin has not been untouched by that. So we have about half of our nursing positions are open right now. So that's almost 10, 11 nursing positions that are open across the organization. Providers, we're more fortunate. We don't really have, we have maybe one open provider position right now, but it's primarily nurses and the support staff that are the positions that are open for us. With the support staff, so a medical assistant or a receptionist, those are some of the positions that are open right now as well. It's just been a challenge to fill those positions. And so when you're in a team as a doctor and you don't have a nurse and you don't have a medical assistant or you don't have a receptionist, how do you function? It's very, very challenging. So if I had a magic wand, I would definitely fill all those positions.
It's interesting. I work in a home and community-based space, and what we've started to see, so we're not a facility so much from an administrative standpoint. We have payroll, marketing, human resources, customer service, call center, that kind of thing. Our clinicians and therapists go out into the field. What we have seen in the last 2 or 3 years is a decrease in a lot of the nurses and therapists going into the neighborhood. That we're starting to see them pick and choose zip codes if they want to go out. A lot of them have returned to facilities for safety reasons. Do you think that there's a weariness? Because back in the day, when I was coming through, when I first started my career, I worked with 2 of the major health systems in Philadelphia. And so they used to offer bonuses. It used to be pediatrics and geriatrics were the last 2 things that were picked for whatever reason. Nobody wanted to see sick kids and nobody wanted to deal with end of life. I'm going to say nobody, but it wasn't on high on the list of people. Are you seeing nurses really flock to any discipline more than any other?
I would say it's probably very similar. Nurses have a hesitancy sometimes around pediatrics.
Okay.
And I would say a hesitancy. It's almost like an anxiousness and they're not small humans. They are unique in sort of their needs and how you provide services for them. But I have noticed a hesitancy, an anxiousness particularly around giving immunizations to children, and that's sort of the bread and butter of what we do in pediatrics. And so, yeah, that is definitely one of the challenge areas for us as well.
With hiring nurses, a few of the health systems that shall remain nameless have decided that they only want 4-year degree nurses for, I guess, to maintain some type of accreditation. I mean, when you have some of the medical managed care organizations, the insurance companies, starting to really pay reimbursement based on value-based pricing and that kind of thing, you're in a unique niche when you talk about community health. Right. So are you able to hire nurses that have a 2-year degree, or they have to have a 4-year degree?
We do prefer nurses that have a 4-year degree, only because they have a higher skill set.
Okay.
And our patients are so complicated. You know,
Okay.
they just have
Fair.
such a, complicated set of needs
Right.
that we try to hire the 4-year nurses as well.
Wow. All right, we're talking here with Dr. Kimmy Ali at the Henry J. Austin Center down in Trenton. And we're going to take a quick break, but I want to remind our viewers that you can check me out on the radio. My radio show is on WURDradio.com or 96.1 FM on Saturdays at 4 p.m. You can check me out then. All right, we're going to take a quick break. Don't go away. We got more to talk about and more to unpack.
Did you know?
Dad, you can't do this anymore. I think it's time to consider a nursing home.
But I don't want to leave my home. All my stuff.
But Dad,
Alva.
Always Best Care is here to help.
With Always Best Care, we come to you and do anything you need to continue living at home with our care.
You really are a hero.
Let Always Best Care take care of your loved one. Everyone deserves the best care. Always.
Let me help you with that, Mr. Smith.
Oh, thank you.
How did this get here?
You got one too?
Yeah.
Ah, new recruits? I'm sure you're wondering why you're here. This is our Elite Caregiver Super Training Center, and you two are the perfect candidates.
This is incredible.
I know, right? Ready to become an Always Best Care caregiver? Working for the best team with competitive pay? Join Team Green.
Always Best Care supports diversity. There's a hero in all of us.
Did you know?
Welcome back to the Did You Know show. You know, if I could really take the outtakes, I had to work on that one time. When we talk about when we go off the air. But anywho, we're back and we're sitting here. We're having a great conversation at the Henry J. Austin Center with the CEO, Dr. Kimmy Ali. Henry J. Austin, tell us about him.
So Dr. Henry J. Austin is a very interesting individual. So he was born in Tallahassee, Florida.
Okay.
And like many individuals, there was a great migration. And so he moved up north with his family. And he actually moved to Princeton. And that's where he grew up, in Princeton. Then he went to Brown to go to medical school. And then he came back to Princeton when he was all done. And because of the laws at that time around Jim Crow, he was actually not allowed to practice in Princeton. So he decided to come to Trenton, and that's where he set up his office. He was a really strong advocate, and he is, by a lot of historians, he is credited with desegregating the schools here in Trenton.
Oh, wow.
Yes, exactly. He lived right down on Bellevue Street. There's actually a picture of his home. You can Google it on the internet. But he was a really interesting gentleman who was a strong, again, activist within the community. Not too long ago, I actually met 2 sisters that were born by Dr. Austin.
He birthed them.
He birthed them, yeah. I mean, it was just amazing to hear them talk about him and the story sort of firsthand. But that was who we are named after. And so with that really strong and rich legacy, Henry J. Austin has really been dedicated to providing the kind of care that is sort of imbued with respect and dignity. It is one of the reasons we do what we do in the way in which we do it, really providing those services that are needed for the community, but in a way that allows for that respect and dignity.
You know, in a world where we still have to deal with the racial tension, you said it earlier in the top of the show how people are sometimes treated according
Right.
to their means, status, class, wealth, sexual status, all those kind of discriminating factors. But, you know, for me, I made a decision early on. You know, my business model for the franchise suggested that we go after private pay, right? And I went against that because there's more people with less means than there are with means.
Right.
And so, you know, either you hunt elephants, if you will, versus gazelles. And so in my mind, when you're in the community, you get so much more of a vast, rigorous kind of a feel, for me. Everybody doesn't want to do community health. I enjoy it. And I can tell from your energy you enjoy it too. And well, what's the makeup of, we talked about, your call to action in terms of hiring, which your wish list, but what is the current makeup in terms of structure and that kind of deal? Is there a board?
Yes.
Is there an executive team?
Right. So there is, and so it starts with our board of directors, and right now we have 10 board members. Our chair is Mr. Charles Davis, so underneath him there's 9 other board members who really are sort of provide that oversight and guidance and direction for the organization and are real partners with that senior and executive team. And then from the executive team there are 4 chiefs, and from there we have several directors. We have about 12, 13 directors, and then we have our managers and our frontline staff, our providers, our nurses, receptionists. We have about 210 employees overall that provide the services.
Wow, and you have that's divided over 9 locations.
That's divided over 9 locations.
Wow,
Yeah.
wow. And so, we talk about the services. I don't know if we got deep into it, but I want to go back to that if you don't mind. Dentistry.
Yes.
So, what kind of services are you doing here in terms of dentistry?
Right. So within 2 of our locations, the Warren location and the Ewing location, we have dental suites. We have about 5 dentists. We have 2 dental hygienists that provide the services, that provide all our dental services. And that's really important within the city of Trenton in particular. There are really no organizations that provide for the uninsured. Now, there are other dental offices, and as an individual, if you don't have insurance, you walk into one of those locations and you simply pay whatever that fee is. Is it $200? Is it $250? Whatever that is. What makes Henry J. Austin and other community health centers unique is that we are federally funded to a degree so that we can provide what's called a sliding scale. So we base it on your income. So depending on your income, you could pay as little as $20 or $40 for a dental visit, up to $65 if you fall within that slide, within that level, depending on income. And we are the only health center that does that. So other institutions where you walk in, you just pay whatever that full fee is.
Right.
But because we're a community health center, we're able to slide that depending on the level of income you have.
And so you do pediatric dentistry as well as regular,
Yes.
like I'm a dentist. You do oral maxi and all that kind of
We do pediatrics, adult medicine, and we have quite a few procedures. So if you need like a crown, you need dentures, we do quite a bit of dentures. Is a real big need in our community.
Wow. And do you work with other organizations to refer out, in one way I want to say business, but referrals that you don't do?
Yes.
I don't know if you do braces.
Yes, no, we don't do braces.
Okay.
So there are a couple of oral surgery groups that we work with, and we've worked with very closely throughout the years, yes.
Wow. I'm sitting here with Dr. Kimmy Ali. I'm going to take a tour of the facility, and we're going to talk more about what's going on. I'm going to get Alona Dupree, who's the Chief Development Officer for the facility, and she hooked us up together.
That's right.
And anyway, we're going to take a tour of the facility, and we're going to come back and we're going to wind up the show, talk about the strategic vision, the initiatives, and the plans, and looking ahead. Please don't go away.
Did you know?
Dad, you can't do this anymore. I think it's time to consider a nursing home.
But I don't want to leave my home. All my stuff.
But Dad,
Albert.
Always Best Care is here to help.
With Always Best Care, we come to you and do anything you need to continue living at home with our care.
You really are a hero.
Let Always Best Care take care of your loved one. Everyone deserves the best care. Always.
Did you know?
Welcome back to the Digital Show. I'm here with Alona Dupree, and she is the Chief Development Officer at Henry J. Austin, my long-term friend. Yes. You've changed a lot of chairs since I've known you. But she's going to take us through the Henry J. Austin. We're at the Warren Street. No, we're at you're at the Ewing Street.
Yes.
We're at the Ewing Street location. And she's just going to give us a quick tour of the facility. We're standing in the hallway right now that separates the dental And then adult medicine.
And then we have pediatrics to the right.
So where are we going, Alana? You take it for
Let's start with pediatrics, and this is where our little patients. This is where we see our little patients, and it's a very bright space.
Okay.
It's something that we're very proud of in this location. Hi there.
Hello.
This is our waiting area, and I'm going to take you through inside to see some of the locations where we see our patients.
All right.
And you'll see the typical exam rooms that you may notice at any pediatrician. This is one of the exam rooms.
You may have noticed that we have put our masks back on because we are in the facility, and right now that is a requirement to walk through this facility is to put your mask on and that kind of thing. So you can't see my supermodel friend.
Our pediatrics extends through this way.
The K9 engine exam room.
Oh, that's cute.
I like that. I hated coming to the doctor at first until I got to know my pediatrician. Shout out to Dr. Tapper. He was wonderful. South Philadelphia.
Even now I remember taking my children to the pediatrics. It's scary. So seeing bright spaces is really helpful for children. And usually at our main location over in Warren Street, in 321 Warren Street, we have a big pediatric unit over there, but that's soon being renovated to match this space as well.
Okay.
This is our adult medicine unit, and this is what a typical exam room looks like.
Okay, this is a typical exam room.
Correct.
Blood pressure and all that kind of a deal. Okay. Now you guys are doing you are doing vaccinations, correct?
Correct.
And boosters and that kind of a deal.
Correct. So we do vaccinations, both Moderna, Pfizer, and Johnson & Johnson, so that's 3. But we also do boosters 1 and 2.
Okay. Now you guys again are open from what, 9 to 5 or 8 to 5?
We're open from 8 to 5, and then Saturdays from 9 to 1 p.m. at our Warren location.
Okay. This is nice.
And this is also where we do a lot of our behavioral health counseling. So our counselors will utilize some of these rooms. And this is one of our telemedicine rooms where our nurses can do telemedicine, as Dr. Ali spoke about.
Okay. Oh, wow. So business development, so your role is to make sure that you get funders and grant people. And do you write grants, Ilona?
I do write grants. So about 2 years ago, the board of directors and Dr. Ali, when they were working on the strategic initiative, they really thought it was important to start a department that really focused on fundraising and growing our funding to support the services that we offer, but also expand. One of them was being dental services, as Dr. Ali talked about. So I was brought on board about 3 months ago, so that was past December, and we're really working on increasing private donations, but also increasing our grants. We're working with a lot of federal grants, private donations, and foundations.
Okay. Where else are we going?
I want to show you, Bryant, this is our dental unit at our Ewing location.
Okay.
This is very popular.
Okay.
One of the biggest services that we offer at Henry J. Austin, and one of the greatest needs in Trenton right now. So these are some of the exam rooms. We also have pediatric dental services, which is great because we get to see little patients to ensure that they're keeping their teeth clean. This is one of the rooms for our dental services.
Oh,
this
wow.
is what you will see at every exam room.
The beloved dentist. Oh.
Yes. We try to keep it fun and exciting for patients, especially for our little patients.
Okay.
Because I know that can be a little nerve-wracking.
Okay.
So our dentists and nurses are really trained in working with our little ones to ensure that they have a great experience at Henry J. Austin.
Oh, wow. Great. So here you have it at Henry J. Austin Center on the Ewing Street. This has been wonderful. Thanks, Ilona. Thanks, Ilona, for giving us a little tour.
Of course.
Again, viewers, you can look at the bottom of your screen if you're interested in checking out more and get more information about the Henry J. Austin Center. They have 9 locations. We're at the Ewing Street. But if you want to look into donating or even soliciting their services, certainly look in and give them a call.
Yep.
Thank you so much. Good
Thank
to see
you.
you.
It was good to see you.
too.
Henry J. Austin means to me home away from home.
A savior in the community.
Henry J. Austin means everything to me.
Henry J. Austin Health Center is what you need in your life.
When I walk through Henry J. Austin doors, sometimes I don't want to leave.
I feel family.
There's always a smile on everyone's face when you come through the door.
I just love this place.
It is immensely rewarding for Henry J. Austin to have our rebirth at this time, our 50th anniversary. We envision many more years, another 50 years of this great work that we've been doing in and around the city.
Henry J. Austin Health Center for over 50 years now has provided life-saving and quite frankly, life-changing healthcare to countless people.
So many people have gone without health care because they did not have what they quote insurance. And when they did realize that they could come to the health center and receive the same services, it became such an important place for them. And the people that work here make people feel comfortable enough to come in and let's see what we can do for you.
One of the hallmarks of Henry J. Austin is how we look to our patients to help inform and guide us in terms of their needs within the community. And then we shape our organization to meet those needs.
There's a lot of respect and caring and empathy. I think that was the theme of Mr. Austin, to make sure that people are getting quality health care. And so I think that the community feels that when they come to the health center.
I've been a patient at Henry J. Austin for over 30 years. They give you so much respect. They're very caring people. And there's no place I would rather be than to come to Henry J. Austin. No matter what it is or what I'm going through, I always look to them.
I've been a patient here at Henry J. Austin for about 46 years. And what they used to do was come and pick up all the Head Start children and bring them to the dentist. So that was like 1974. And I've been coming to the health center ever since. It's just been one of those type of places that always felt like home. Even with health insurance, without health insurance, always came to the health center.
We represent the community, the city of Trenton, the place you can go for whatever your situation may be.
This has been a transformative year for Henry J. Austin Health Center. In addition to launching a new brand where we've changed the look of Henry J. Austin Health Center, we've also been engaging in major renovations at our Warren Street site.
With our renovations here at Henry J. Austin Health Center, the message that I hope it sends to the community is that we value you. And one of the stories that demonstrates this is a patient actually came in when we had first redone the waiting rooms, we'd done some of the conference rooms. You know, the colors are bright, they're warm. And the patient came up to the registration desk and asked our registration clerk, "Why did you do this?" And the registration said, "Because we want to make the center better for you." And she said, "You did this for me?" And they said, "Yes." So it's so moving. And because far too often, people in communities like this are simply overlooked. And you hear stories where people say, they didn't even see me. I am not recognized. Not only am I not valued, but I'm not even seen. At Henry J. Austin Health Center, we see you.
It makes me feel good that Dr. Ali wants to have the physical area match what it is that we provide as providers. It makes the team feel good. It makes the patients feel good to come into a beautiful space like this.
It feels wonderful to walk through the door and see the amazing work that's being done here at Henry J. Austin Health Center. They have renovated the place and just added more life to it, and this is the place for the next generation of Head Start children and pre-K and Abbott children to come through and go to the dentist and get their health screening. It's the place now, you know, and I just really hope that more people utilize it.
It sends a message of that we care, that we're professional, and that whatever health needs or mental health needs that you have are going to be addressed in a very professional manner.
I see the future for Henry J. Austin Health Center about how do we become better? How do we provide the best care we possibly can for the people we serve, because they deserve it. Not only do they need it, we know they need it, but they deserve it.
Henry J. Austin is a place that you can always come to find help.
We're committed, and we're going to continue providing services, quality services, to families in the city of Trenton.
There's this overwhelming sense of commitment to getting the job done and in the best possible way. And there's this also underlying current of loyalty. Loyalty to the mission of providing quality, integrated healthcare to not just one, not just two, but all who choose to access it.
Did you know?
Let me help you with that, Mr. Smith.
Oh, thank you.
How did this get here?
You got one too?
Yeah.
Ah, new recruits? I'm sure you're wondering why you're here. This is our Elite Caregiver Super Training Center, and you two are the perfect candidates.
This is incredible.
I know, right? Ready to become an Always Best Care caregiver? Working for the best team with competitive pay? Join Team Green.
Always Best Care supports diversity. There's a hero in all of us.
Did you know?
Welcome back to the Did You Know Show. Again, I want to remind our viewers that I'm on the radio. You can check me out on Saturdays at 4 p.m. on WURDradio.com or locally at 96.1 FM or 900 AM. The Did You Know Show is centered around connecting people to home, community, and business resources that you ordinarily wouldn't know about. And I felt like I've learned a lot about the Henry J. Austin Centers. But as we wind down the show, Dr. Kemi Ali, who is CEO of these facilities, let's talk about the strategic plans, the strategic initiatives, and looking ahead. What do you see? What's your vision?
Oh, so it's a lot. So having
okay, come on with it.
so having been here for a while, you know, one of the things that I always, as I mentioned before, you know, treating our patients, the individuals that walk through our doors with that respect and providing that care in a way that's dignified was
no health
always,
shaming.
Exactly. You know, it was always so important to me. Mm-hmm. I wanted a place where I would feel welcome coming. I bring my son here. He gets his health care. The providers here helped deliver my son when he was born. I came here for my care. So I wanted a place where anyone could feel a sense of pride when you walk through the doors. Mm-hmm. So often in communities like ours, that's taken for granted. Mm-hmm. It's not a focus, it's not a priority. So one of the things we've been doing over the last year is renovating all of our buildings, all of our spaces, like this one.
Okay.
So, you know, new lights, new walls, new floors, new windows, new doors, you know, the whole sort of kit and caboodle at all of our facilities, again, so that I think the facilities on the outside mirror the great work that we do on the inside. So, you know, as we look strategically forward into the future, would we like to have another facility? Sure. As we talked about, dental is really important. And so we've really have maxed out in terms of providing dental services. We can't really do much more with the spaces that we have. And so that if we wanted to even bring on additional dental services, we need a new space. We are in the process of renovating our flagship location, which is the Warren Street, the Warren location. And we're joking with our architects that, so yes, when we're ready to build that 3rd and 4th floor, they're planning for that. So right now we are 2 floors at Warren. But again, the need is so great, particularly for those services that you wrap around. I mean, talking about GI and colonoscopy services, I would love to be able to have a colonoscopy suite for our individuals that are uninsured, have a mammogram suite for our individuals, because we know those kinds of services are really challenging for our patients to receive, particularly when they're uninsured. And then we also talked about the opioid epidemic. I would love to have a pain management center.
Oh, wow.
Yeah, so where you could come and get a whole host of services, acupuncture and aromatherapy and art therapy, all those things that you would need in a full pain management alternative for opioids. So having something like that, I think, would be amazing.
Let me ask you, as you're sitting here talking too, you know, one of the challenges that I have with my business is oftentimes good employees need child care, particularly with regards to, you know, working full time and managing work-life balance. Would that be something that you would consider, maybe opening up an adjunct daycare centers for your employees?
Yes, that's exactly right. It's one of the things we're exploring right now. So we brought on a consultant to sort of give us a landscape of what's available, what's out there, help us with planning and thinking about what that might look like for the very reasons that you mentioned. It's really a challenge for our community. And when you look at Henry J. Austin Health Center and others like us, probably very similar with yours, we have a lot of women who are in our organization, many of whom are single moms. And so again, that challenge of childcare is
to our single dads too.
That's right.
But for the single parents, it's a real thing.
It's a real thing.
And really, you know, I guess in my mind, you know, we dealt with, in a home and community-based space, we dealt with a lot of issues that were apparent and right there present before the pandemic. But when we went through the pandemic, it was a really big deal. To the point that I just started, you know, for kids that were well behaved, you know, they could call me Uncle B, you know, for the kids that were well behaved, you know, you could bring your children to work and let them sit in the conference room from 8 to 14. So this way you could come, because, you know, you can't exhaust all your PTO time. And we had to really, I think child care, in my opinion, meets the moment.
Right.
It's a bite out of 2 apples, because one, the community can benefit from it, and then your employees can benefit from it, and then it becomes a safe haven all around. You know, for me, watching my mother, who was a single mother, you know, watching her a lot of times work 2 and 3 jobs, you know, I was the original latchkey kid. I really was.
So was I. Key around the neck.
Key around the neck, and nobody thought of even a kid that, like, no, we don't want that smoke. You would never do that now. Have your kid with a
I know, right?
You would never do that now. Walk home from school with the key around the neck. Call me when you get home. That kind of thing, and sit there. Do not go outside until I get home. All those kind of rules have kind of evolved.
Nobody ever sat in the house. You just timed it right.
You timed it. You knew exactly. You could almost hear her car from 2 blocks away, and you got back in. You know, and if you were on punishment, you know, they say things like that. Don't turn the TV on until I got home. But when you talk about education, I know a lot of home and community-based spaces are becoming hotspots.
Yeah.
Because a lot of people don't have access. Even in 2022, a lot of people don't have access to the internet. Something as simple as you never think of something as simple as the internet. But when you think of a community place, I know the tentacles that go out in the community is important. So when you also talk about land use, are you going to kind of come out of Trenton, or are you going to, this is still going to be, like you said, I love you say your flagship, you know, Warren Street. Are you, you know, is it in your plan or your thought to maybe expand out of this demographic?
It definitely is. So right now we have a proposal to, for example, get a second mobile health unit.
All right.
And continue to grow and expand. Just as you said, it's really important to bring those healthcare services to the areas that are needed. So again, we're focusing right now on improving the facilities we have, and once that's done, yes, our thoughts are definitely to continue to think about how do we bring the services needed, because there are other pockets, particularly across the county, that have individuals that are sort of marginalized or overlooked, and how do we bring those services to them?
So another thing too, now as I'm sitting here talking to you, is Henry J. Austin a 501c3?
Yes, it is.
So that means then that if people are out there and you're watching, you can obviously make a donation.
That's right.
You can make a donation. You look at the bottom of the screen, you'll see the website. You can make a tax deductible donation. But in your vision, are you putting together maybe a marquee ball event to raise event as the world continues to open up?
We probably will in our near future. Yes, we have not done one before,
okay.
But as we look really to establish ourselves and so that individuals know who we are and what we do, and more importantly, what we stand for as an organization, that is one of the things that's on our list to do.
I have had a wonderful time sitting here talking with you. Your energy is contagious. You can tell just by virtue of the staff, that's indicative of leadership. It's not easy, as we discussed offline. It's not easy to work in a home and community-based space. And I would argue to say, when I interview leadership team members, I often ask them, do you have any type of direct or indirect dysfunctional experience? Because if you don't, this might not be a good fit for you. Working in a community, if you like the community, is good, but it's not for everybody. It's really for the strong people that can handle a lot of multitude of issues and that kind of thing. Dr. Kimmy Ali, thank you so much for coming on the show. I really appreciate it. And if you guys need an MC for your event, whenever that comes up, you need me to donate some raffle items. I certainly would be into doing that.
Thank you.
Yeah, and again, your energy has been contagious. And we're going to have to come back and maybe down the road and see as you guys continue to accomplish your milestones.
That's right.
And really do it. All right, this is Did You Know Show. That's my story. I'm sticking to it. Dr. Kimmy Ali, again, thank you for coming. She is the CEO of the Henry J. Austin